Cancer is a complex disease that affects millions of people worldwide. It can develop in any part of the body, and cancer cells are abnormal cells that grow and divide uncontrollably, potentially leading to the development of cancer. In this video, we will take a comprehensive look at cancer cells and how they contribute to the development of cancer, how they spread, and how they are treated. What are cancer cells? Cancer cells are abnormal cells that have lost their ability to control their growth and division. Unlike normal cells, which grow, divide, and die in a regulated manner, cancer cells continue to grow and divide uncontrollably, forming a mass of cells called a tumor. These tumors can be either benign or malignant. Benign tumors do not spread to other parts of the body and are usually not life-threatening, whereas malignant tumors can spread to other parts of the body and can be life-threatening if left untreated. How do cancer cells spread? Cancer cells grow and spread through a process called metastasis. When cancer cells grow and divide uncontrollably, they can break away from the original tumor and enter the bloodstream or lymphatic system, which can carry them to other parts of the body. Once they reach a new location, they can grow and divide, forming new tumors. Metastasis is a complex process that involves many steps. First, cancer cells need to be able to break away from the original tumor and invade nearby tissues. Then, they need to be able to survive in the bloodstream or lymphatic system and avoid being destroyed by the immune system. Once they reach a new location, they need to be able to establish a blood supply and grow into a new tumor. What are the common types of cancer cells? There are many different types of cancer cells, each of which can behave differently and respond differently to treatment. Some common types of cancer cells include carcinomas. These are cancers that develop from cells that make up the skin or the lining of organs, such as the lungs, liver, or kidneys. Sarcomas. These are cancers that develop from cells that make up the body's connective tissues, such as bones, muscles, and cartilage. Leukemias. These are cancers that develop from cells that make up the blood and bone marrow. Lymphomas. These are cancers that develop from cells that make up the lymphatic system, which is part of the immune system. How are cancer cells diagnosed? There are several ways to diagnose cancer cells. One common method is through the use of imaging tests such as X-rays, CT scans, and MRIs. These tests can help detect the presence of a tumor and determine its location and size. Another method is through a biopsy, which involves removing a small sample of tissue from the tumor and examining it under a microscope. This can help determine whether the tumor is benign or malignant and what type of cancer it is. How are cancer cells treated? The treatment of cancer cells depends on several factors, including the type of cancer, its stage, and the patient's overall health. Treatment options may include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Surgery involves the removal of the tumor and any surrounding tissue that may contain cancer cells. Radiation therapy uses high-energy radiation to kill cancer cells, while chemotherapy uses drugs to kill cancer cells. Targeted therapy and immunotherapy are newer treatment options that target specific proteins or immune system cells involved in cancer growth. Conclusion. Cancer cells are abnormal cells that have lost their ability to control their growth and division. They can develop due to genetic mutations or exposure to environmental factors. Cancer cells grow and spread through a process called metastasis, which can be a complex and challenging process to treat.